This is my 15.4 sports injury physiotherapy rehabilitation program for 2 clients. So in this first video I'll be looking at the first client, and the second one I'll look at that one. So my first athlete is called Charlie Keys. He's a football player, and he's a striker, and he plays in the Premier League, so quite a high standard. And he's got a grade 3 Achilles rupture. And he done this so during a Premier League game he was dribbling the ball towards the goal to score when someone on the opposition went in from a tackle from the side and studded the back of his foot where the injury occurred. So as this is a grade 3 Achilles rupture, the estimated time of recovery is 4 to 6 months. This program is over 6 months, so the 26 weeks. And during this there's 4 stages. So the first stage is acute, the second is functional movement, the third strengthening exercises, and the fourth sport-specific training. So during the first stage, phase 1, the acute phase, you want to reduce pain and inflammation. You do this by the training focus is literally pure rest until all the pain and swelling's disappeared. The second stage is functional movement. Is where you introduce proprioception and you introduce light static stretches to improve range of motion, and then also dynamic and ballistic stretches, as well as balance and stability exercises. So it could be specifically like foam rolling, and where you introduce the proprioception, and that's around 1.5 months to 2.5 months. The third one's are strengthening exercises, so around weeks 9 to 16. So phase 3 is where it's body weight and weight exercises. So the focus of this phase is to introduce the body weight exercises, free weight exercises like resistance machines, and then towards the end of the 4 months, like eccentric loading and loading stretches to gain weight and balance on the ankle. And the fourth stage, so the last 2 months of the program, is sport specific training, so getting back into that sporting environment that they were in before they got injured. So sport specific training, so it's like introducing lateral movements and change of direction, introducing speed into exercise drills, plyometrics and change of direction, and replicating sport specific drills into your training. So it'll be like bringing in dribbling and shooting and back football specific things back into his training. So at the end of each training focus in each phase, what will happen is there will be a review process. As you can see, that little yellow bit is that review process to see whether you've achieved the goals and if you're ready to move on. So if they are ready to move on move forward in progressing and keep moving on in the process. However, if they're not, we may have to increase the time of a certain phase. For example, if during the strengthening exercise phase the client isn't ready to move on to the sport-specific exercises and the joint still isn't getting strong enough, then we may have to increase this phase, maybe to 9 to 20 weeks. So it's about adapting it and changing it to the athlete's needs. And also, if an injury became worse or they suffered pain, then this would be assessed in the review, and a course of action would happen, whether this is to increase the stage or regress back to a previous stage to re-achieve the targets and get some strength back into that specific injury in the Achilles. So next is this graph, which shows the 3 stages of healing that the client would experience when going through the rehabilitation program. So as you can see, the first blue line shows the inflammation stage, which is the immediate response to any injury. So this will include the initial pain that is felt by the person, as well as the swelling that may appear to the injury. Next is the orange one, which occurs a bit later and lasts a bit longer. And it represents the repair phase, and this is focusing on stability, range of motion, and the strength of the joint. And the final stage, the grey line, is the remodeling stage, which is where the client is able to balance and put pressure on the joint or the injured area, but scar tissue is still forming. So next, moving on, is the treatment plan. So this coloured chart, and the treatment areas which I've chosen is taping, electrotherapy, thermotherapy, IASTM, and soft tissue massage. So this table basically shows like the importance in each stage. So 9 being the most important and 0 being not important during that time. So as you can see, I'll go more into further detail later, but for example taping, it's got 9, so I think during that first like acute phase, in the first couple of weeks of the injury, taping will be very important. Whereas soft tissue massage at the bottom, you can see it's in red, so it's 0, which like during the acute phase, I think this isn't appropriate. But then later on, it gets more appropriate during more sport specific and strengthening and the body weight exercise phases. So, and the graph underneath this is just a visual way of showing during each phase what form of treatment would be used and most appropriate to get them back playing sport specific games as quick as possible and healing their injury. So the treatment overview, so this is basically what is going on in that coloured boxes. So the information phase. So firstly I'd use taping, as this is used to maintain a stable position for the foot, which reduces the pain and aids recovery. So the taping can be left on for 5 days, but should then be replaced with a new one. So when applying it correctly, it works by lifting the skin and creating a small space between the muscles and dermal layer. So this space takes the pressure from the swelling and allows smooth muscle movement. So during the repair phase, I'd use thermotherapy and electrotherapy. So as you can see later on in the colour charts, it goes on to 9 at around like 6 weeks, and that is during the repair phase. So I'd use the electric therapy on the Achilles, as this uses electrical signals to interfere with the transmission of the neural pain signals to the brain, so it effectively slows down and distracts the messages from the nerves to the brain. So this use of electrocurrent speeds up tissue healing. And also around the 4 weeks, I'd use the thermotherapy as well as this, around like 3 times a week, as this uses heat, which could be a hot cloth, ultrasound or heating pack. So this technique helps to improve circulation and relaxes muscles. So it's again just giving it time to heal. And the final stage was the remodeling, was where I'd use the soft tissue massage, which is the soft tissue in the ISTM. So I'd use the soft tissue around like week 20, as this targets muscles and tendons, so it helps to alleviate aches and pains. So the lighter pressure helps to break apart muscle bundles and releases endorphins to reduce muscle tendons. So the final couple of weeks after the soft tissue, I'll be using the ISTM, which helps to break up scar tissue and improve range of motion. So it stimulates an inflammatory response, which enables scar tissue to be remodeled. So again, if like he gets worse at some point, we could go back a stage and use the different types of treatment to really help improve it. And then lastly, we have the short-term, medium-term, and long-term targets for the client. And the first couple of short-term ones, I've based it on the different phases, so linking it to the different training focuses for each stage. So the first one, we progress from static to dynamic stretches. So again, this is part of the training focuses to move on and start to build strength in the ankle and slowly get the Achilles working properly again. The second one is to introduce small daily exercises. This is mainly purely just to keep the joint moving and stop it from seizing up and getting worse, because we want to keep it moving and keep getting better, because that is what is prescribed nowadays, is to keep it moving and get it going again. The third goal is to keep a positive mindset, because we want to keep him motivated and knowing that he's going to improve and get better and get back playing football again. And then the latest short-term goals is more for the sport specific, as he gets to that stage around the 5 months mark. So we would use football specific skills with the ball, so this could include like dribbling, and also attend football training once a week. So this would be a little one just so he slowly gets back into it and builds it up again. And then the medium term target is to complete the rehabilitation program. So just to complete this 9 months, and hopefully he'll be back playing after that. Attend football training twice a week with the second team. So again, this is just, it won't be too much pressure and too much hard work on his ankle, but again, it's slowly getting the sport specific training back in and getting his physical ability back into it. And then training with the first team once a week if this isn't too hard. So again, this will be a bit more pressure because obviously they're a better standard, and slowly getting back into that first team. And the last one's to play a game with the second team. So getting that sports like game fitness back into the 90-minute game will be essential to recover really. And the long-term target is what most of them be get back playing with the first team, full duration of the game at their local club. So looking at the specific exercises that I prescribe for each phase, so this is the phase 2, so the functional movement phase. And again, it was looking to introduce light static stretches to improve the range of motion. So for that, I'd firstly the exercise would be like to roll the injury with a tennis ball. So that would be like the middle picture. As you can see, he's using the tennis ball just to slowly start to roll the Achilles. And if this was too hard, the regression would be to hold the leg straight and start to rotate it. So that would be the picture on the left. As you can see, it's just using his own body weight to move it. And if it was too easy, a progression would be to roll the injury with a harder ball. So getting that harder, denser into the Achilles would be harder. And then apply the pressure with the other leg with a bigger ball. So that would be the picture on the right as he's putting pressure with the other leg with a larger ball. And we'll do this 10 seconds at a time, and then 10 seconds in between, and we'll do this 3 times. And then the second exercise would be standing on a balance board, so literally just standing on the board. And if this was too hard and the balancing was too hard, a regression could be just standing on the floor and raising the toes up and down. And if standing on the balance board was too hard, you could do it with one leg, or again, if that was too easy, you could lunge with it. And then the last functional movement exercise looks into the dynamic and ballistic stretches, so the stability exercises, which is a balance board, which is the picture on the right. So as you can see, they're standing on the balance board lunging. And if this was too hard, a normal lunge, so a picture on the left again, just on the floor doing a normal lunge. And if that was too hard, a reverse balance board lunge, so going backwards on the balance board lunging. And again, this would be 8 reps of 3 sets and 10 seconds between each rep.